Hi, it's Paul. I want to look at non-small cell carcinoma. So these are cases where we have difficulty in determining whether the tumour is squamous or glandular. And this occurs when there's less obvious differentiation present. It's usually easy to say that it's malignant and easy to say that it's carcinoma because it's cohesive. But if there's no obvious mucin production or keratinization, for example, then it can be difficult to separate the two. In the past, this was not really considered a problem, and we frequently reported non-small cell carcinoma. Nowadays, because there are such tailored treatments for adenocarcinomas with specific mutations and for squamous cancers, that separation is very important, and that needs to be done either with immunohistochemistry or on biopsy specimens with immuno. So I just want to show you a couple of cases that illustrate the sometimes difficulty with this, and these are probably not the greatest cases, but they will be sufficient to illustrate what I mean. So this is a bronchial washing specimen. I can tell this is malignant and that it's epithelial because of the cohesion. There's extreme hyperchromasia and variability in nuclear size, but I can't really see into this well enough to really determine what I'm dealing with here. Similarly here, so there's normal bronchial epithelial cells that are elongate. You can see terminal bars on them around here. And then we have quite enlarged hyperchromatic malignant cells in here, maybe a vacuole there. And maybe some of these nuclei are looking eccentric. Just looking around, another group here, these ones are showing more centrally placed nuclei, I think, particularly along the bottom there, and the cytoplasm has quite a well-defined border to it. So a couple of mixed messages here, and there's possibly some vacuoles in this, but the border is very well defined and the nuclei look a little eccentric, much larger than that normal bronchial cell. So I'm thinking this is probably adenocarcinoma, but I'm not 100% sure on that. This is another case. Again, we've got a crowded hyperchromatic group here. These cells, the obvious feature is very large single central nucleoli, which maybe makes you think adenocarcinoma. But that dense three-dimensional group in the middle there certainly looks a lot like a squamous crowded hyperchromatic group. And again, I'm leaning towards adenocarcinoma, but no real vacuoles there. This is FNA, and it can be quite a common problem with that. So here we have cohesive groups of malignant cells. This is the Pap stain, and these are looking like crowded sheets of cells. I think there are maybe targetoid vacuoles here, and there's certainly fine chromatin, prominent nucleoli, so I would certainly favour adenocarcinoma in this, but you can see it can be quite a tricky decision sometimes. Is this squamous or is this glandular? And we do try to avoid saying non-small cell carcinoma, but sometimes on cytology that's really all that's possible based on morphology alone.